Why are COVID-19 infections high in boosted Americans? A difficult fact confronting health officials in the midst of the latest COVID-19 outbreak is that even many boosted Americans are prone to contracting and spreading the virus, at a time when they are cautious of reinstating pandemic measures like mask regulations. For the week ending April 23, federal data show that the incidence of breakthrough COVID infections in April was higher in boosted Americans than in unboosted Americans, despite the fact that rates of deaths and hospitalizations were lowest among the boosted. The latest findings do not imply that booster doses increase the danger. Continuing research shows that booster doses provide greater protection against infection, serious disease, and death. The change highlights the increasing difficulty of evaluating vaccine effectiveness at this point of the epidemic. It comes as policymakers consider important decisions on booster vaccinations and pandemic surveillance, including whether to use crude case rates at all. One of the dynamics here is that people believe they are more protected than they actually are after vaccination and boosting, so they raise their risks, explained John Moore, professor of microbiology and immunology at Weill Cornell Medical College. He believes that is the primary driver of these data. The CDC notes on its monthly dashboard that numerous factors are likely to affect crude case rates by vaccination and booster dosage status, making analysis of recent trends problematic. The CDC launched the page many months ago in response to calls for improved federal tracking of breakthrough cases. It has been expanded to include information from immunization records and positive COVID-19 testing from 30 different health agencies around the country. According to the CDC, the prevalence in boosted people could be due to a greater incidence of prior infection among people who are unvaccinated and unboosted at the moment. More enhanced Americans may have abandoned prevention habits like as wearing masks, resulting in an increase. Meanwhile, federal officials are preparing for critical choices on future COVID-19 vaccine shots, which may increase the likelihood that additional shots will be able to protect against illnesses caused by the current variations. CDC Director Dr. Rochelle Walensky recently revealed to reporters that her agency was in discussions with the FDA about expanding the option for second boosters to more individuals. Only individuals 50 and older, as well as some immunocompromised Americans, are currently eligible for a fourth treatment. According to Dr. Peter Marks, the FDA top vaccine official, this transition period, 2022 to 2023, is a year to plan for attempting to limit the effect of COVID-19 with the instruments available.